Good day, sir. I am Pamela Reinn Sulpa from BSN 1, Block D, Group 6, and I am here to do the return demonstration on the assessment of the skin, hair, and nails. So we do this procedure to know if there is any abnormality sa patient natin, as well as to determine the reason behind the chief complaint of the patient or the client regarding their skin, hair, and nails. The goal of this procedure is to make sure na makakagather tayo ng data, both subjective and objective, without the patient experiencing anxiety or any discomfort, and makakagawa rin tayo ng referral for further evaluation. As for the preparation before doing the physical assessment is we must introduce ourselves as well as to identify the patient and explain to them yung mga gagawin natin na procedure para makuha natin yung complete cooperation from them. Also, we need to perform the hand hygiene by washing our hands, putting on the gloves to prevent any spread of microorganisms that can cause disease. And make sure rin po natin na we must observe the appropriate infection control procedures. Then we must provide privacy sa patient natin by closing the door, the windows, and also the curtains. And sa temperature naman po is kung naka-aircon po is babaan na lang po yung sa aircon kasi po yung temperature po of the environment can also affect the information or yung data na magagather natin while we are doing the physical assessment. After that po is we need to have the health history of the patient natin regarding sa kanyang skin, hair, and nails. As for her skin naman po is we need to ask kung lately ba ay nakakaramdam siya ng itchy and painful yung skin niya kapag kinakamot niya, and also ask the patient if may napapansin ba siyang any presence or pag-spread ng lesions, bruises, or pigmented spots sa kanyang skin, and ask din natin if yung patient is nagkakaroon na ba siya ng skin problems before, or kung sa family niya is may mga skin problems. Then we also need to ask kung may ginagamit ba siyang medications, lotion, or any home remedies sa kanyang skin, and ask din natin kung lately ba is napapansin niyang mabilis siyang masugatan, and if napapansin niya rin kung dry ba yung skin niya or moist yung kanyang skin. And the next po is ask naman po natin yung sa hair sa patient natin. So as for the hair ng patient natin, kung tanungin po natin siya kung nagpakulay ba siya ng buhok recently, or nagpaayos ba siya ng hair, like yung nagpa-curl or nagpa-rebond, yung may mga nilalagay na gamot sa hair niya. And then we also need to ask if he or she undergo chemotherapy. And lastly is we need to ask if meron ba siyang present disease na pwedeng dahilan ng pagkakaroon niya ng hair problems. Then, ang last natin kukunin na subjective data ay yung health history ng patient sa kanyang nails. So, ask po natin kung meron siyang diabetes mellitus or kung merong ganitong disease sa kanyang family. And then, we also need to ask if meron ba siyang peripheral circulatory disease, and if the patient had a previous injury or any severe illness na naging dahilan ng pagkaroon niya ng problem sa kanyang nails. So, all this subjective data na ating i-gather will help po sa pag-evaluate ng nursing diagnosis. So, ngayon naman po, let's just say na na-identify ko na yung patient ko, and then nakapag-explain ako sa kanila, and then na-introduce ko na yung sarili ko, and then nasabi ko na rin po sa kanya kung ano yung mga procedures na gagawin ko, and then nakapag-health history na din po ako sa kanya. So, ang gagawin ko naman po ngayon is the physical assessment or yung pag-gather ng objective data. So, as for this one, ang uunahin po natin is the skin po muna na sa patient natin. So, as for the skin po, ang unahin po natin is we were going to inspect the skin color as well as the uniformity of the skin color. As for the skin color po, we must consider kung ano yung ethnicity ng patient natin. So, consider naman po na ang patient natin is a Southeast Asian, and then a Southeast Asian po is normal lang po na kayumang yung color nila. So, kung makikita po natin sa patient natin is kayumanggi naman po yung kulay niya. As for the uniformity of the skin color, as for this one po, dapat po kung ano yung kulay niya sa ibang part ng kanyang katawan is ganoon din po yung sa ibang part. So let's just say ito lang po dalawa niyang kamay, kung makikita po natin is pareho naman po ng kulay niya, and then sa face niya rin po, and then sa may neck niya makikita naman po. So, ang next naman po natin na gagawin is ang pagpalpate ng sa edema if merong edema sa patient natin. So, kapag nagpapalpate po tayo ng edema, dito natin i-determine po natin dito yung mobility, the consistency, as well as the tenderness po. So, let's just say na meron siyang edema dito. So, Titignan po natin yung mobility. Kakapain po natin yung consistency niya po. And then, yung tenderness niya. So, ang next naman po natin na gagawin is we will observe and palpate for the skin moisture as well as isasabay na rin po natin yung sa pag-palpate for the skin temperature po. So, ma'am. And then sa temperature naman po, kailangan na kung ano yung temperature ng kabila niyang kamay is ganun din po dapat dito. Titingnan din po natin kung ang temperature niya po ba is ipapalpate po ba natin kung skin temperature po ba niya is mainit or malamig po. So, ang next po natin na gagawin is sinunod po natin if there is any skin turgor by lifting and pinching the skin on the extremities po. As for this one, pag pinch po natin, titignan po natin kung mabilis siyang mag-bounce back or bumalik yung skin niya sa dati. And then we will document na po the findings na nakuha natin while doing the physical assessment for the skin. So after we physical assess the skin of the patient, we proceed naman po on assessing the hair ng sa patient natin. As for this one, we will inspect for the evenness of the growth over the scalp. Yung sa hair growth po, kung may makikita ba tayong medyo parang may mga palnot-palnot. And then we will also inspect for the hair thickness and then or thinness. And then inspect na rin po natin for the hair texture and then as well as the oiliness din po sa patient natin. So, pagsasabay-sabayin na din po natin. And then as well as we will inspect na rin po or note if there is any presence of infections or infested po by parting the hair in several areas po. I-check lang po natin. We will also check po the spaces behind her ears po along the hairline of the neck po. Ma'am, pwede niyo po tanggalin niyo po yun. Okay po. Thank you po. So, after we inspect nga po yung sa hair niya sa head, then we proceed naman po sa pag-inspect po sa amount of her body hair po. So, there are people po kasi na sinasabi pong mabalbon and there are people na hindi naman ganon. So, we will check po. Sa paa. Meron sa legs. And then, sa legs din po, check din po natin. So, after checking po ng sa hair, ng sa patient natin, yung buong hair niya sa head, as well as sa body hair niya, yung pag-inspect natin is we will document na po the findings na nakuha natin galing sa pag-physical assess natin sa kanya. So, after we physical assess for the skin as well as the hair po natin, then we proceed naman po on the physical examination ng sa nails niya. As for the nails, we will inspect for the fingernail plate shape to determine po its curvature and then yung angle niya po, as well as kasama na rin po natin i-inspect yung fingernail texture niya and then yung bed color niya, and then yung tissue din po surrounding the fingernails, as well as yung last po natin na gagawin is we will perform the blank test of the capillary refill po. As for this one, we will press 2 or more nails between our thumb and then yung sa index finger po natin, looking for a blanching or and return of pink color to nail bed. Check din po natin for the adequate oxygenation. So, ito natin gagawin. And then, gagawin din po natin to, yung mga in-inspect ko po, and then yung binibinirform ko sa fingernails na naman sa paa. And then after that po is we're just going to document the findings na nakuha natin sa pag-physical assess natin sa kanyang nails.